Hi, welcome to the Cognitive Behavioral Therapy for Insomnia Skills series, where each video I'll talk about a specific skill that we typically use in behavioral sleep medicine to treat chronic insomnia. And in this first video, I'm going to talk about sleep restriction therapy. My name is Dr. Parky. I'm a clinical psychologist and behavioral sleep medicine specialist, and I've treated hundreds of patients with chronic insomnia using evidence-based, non-pharmacological, so not using any medication at all, only behavioral and cognitive strategies in the treatment of chronic insomnia. So I've said this in other videos, but sleep restriction therapy inherently is a bit of a misnomer. It's not really meant as a way to reduce how much sleep you're getting, but rather it's meant to reduce how much time you're spending in bed, which is a common compensatory behavior in the context of insomnia. So people who have poor sleep will try to catch up on sleep, and they'll engage in a strategy known as casting a wide net. So instead of spending 8 hours of in bed to get 7 hours of sleep, they're spending 10, 11, 12 hours in bed to try and catch some of the sleep because they're having such a hard time falling asleep and staying asleep. And although this strategy of casting a wide net makes a lot of good sense on paper, it can actually subtly perpetuate and maintain our insomnia over the long term. And the way that I like to explain this to my patients is through something called the sleep dough analogy. So let's say you had 7 inches worth of pizza dough, and then you stretch that out into a 10-inch pan because you just had a really large pan for some reason. What would happen to the pizza dough? And you can imagine that it would probably be very thin. There'd be a lot of holes in the middle of it. And the same thing can happen in the context of our sleep. If we're sleeping only 7 hours, but we're spending 10, 11 hours in bed, our sleep pizza pan is 10 inches or 11 inches, then all of a sudden our sleep also becomes more fragmented. There's more awakenings in the middle of the night, and the sleep itself is going to be very, very light, and you're going to be in this weird twilight zone of sleep and wake. So fundamentally, the idea of time in bed restriction slash sleep restriction therapy is to bring that pizza pan a little bit closer to how much sleep dough you're producing, at least right now. So there's a couple different ways that you can engage in sleep restriction therapy. One way is to just take, how much time you're sleeping, your total sleep time, and that is your time in bed window. I prefer to take a bit more of a conservative approach and usually take total sleep time, and I give 30 minutes of wiggle room. So let's say a person on average over the last week was sleeping 6 hours, then their time in bed for, next little while is going to be 6.5 hours. But usually I don't go below 6 hours. So if a person says, well, I'm only sleeping 3 hours, then I would say, minimum, you're still going to bed for about 6 hours. So where do we put this sort of time in bed window then? Let's say a person has 7.5 hours worth of time in bed. Where do I put it? So usually I usually just like to work with the patient. Like, what's a good time for you based off what you know about your chronotype? So are you a bit more of an early bird, a bit more of a night owl? Do you have to go to work in the morning? And then they'll usually be like, okay, like, yeah, I think it would probably be, 7 a.m. would be good. Okay, so if we're waking up at 7, then we're going back 7.5 hours, and your earliest bedtime would be 11:30 to 7. What do you think about that? And they're like, yeah, that feels right. Or they might be like, actually, you know what? Like 11:30 feels a bit too early. Maybe I could do it at 12, my earliest bedtime, and then wake up at 7:30. Perfectly fine too. Now, when it comes to sleep restriction therapy, people often worry, well, what if I don't fall asleep? Like I'm not sleepy at 12 and at 1, at 2, but then I have to wake up at 7 or 7:30. Like, what do I do then? And the answer is really like you still wake up at 7, and the next night you're going to be extra hungry for sleep. And there's going to be some people who will say, well, I've tried, time in bed restriction or sleep restriction before and it didn't work for me. And it's hard to, answer that question to every specific case, but some of the common pitfalls that I see, one, are people who sabotage the great work that they're doing. So let's say they were supposed to wake up at 7, but they got to bed at 4 and they only had 3 hours. So they were like, well, I need to sleep in more. So I'm going to sleep until 9 or 10. And then that's going to sabotage their night for the next day. Or they're going to take a nap in the middle of the day, which again will reduce our appetite for sleep at the end of the night for the next night. So all of those things will insidiously sabotage the great work that you're doing. And a second common pitfall that I usually see for patients is that there's usually a commensurate increase in anxiety. So even though they're getting more and more hungry from sleep because they're doing the great work to do sleep restriction, on the other hand, their anxiety about, oh, like I only have 7 hours, I only have 6 hours, it almost like creates this feeling of fear that counterbalances and masks the extra sleepiness and the good work that you're doing from sleep restriction therapy. And there's a number of different ways that we can manage anxiety, more than I can cover in this video, but one thing that can be helpful is to trust the process, trust the sleep science, and number two, remind yourself of your resilience. So if you're struggling with insomnia for a long time, there's probably been times where you slept 1 hour, 2 hours, and 3 hours, and you did maybe okay. Like you definitely weren't like on top of the world, you weren't like succeeding in every area of your life, but most people that I know of who've had insomnia get the most important things done. And in this case, you're sacrificing some sleep for the sake of getting yourself out of this insomnia trap. Okay, so you've reduced your time in bed, you've stuck to the schedule, your sleep is improving, your sleep quality is improving, your sleep efficiency is improving, so how much time you're spending in bed relative to how much you're actually sleeping. At what point do you decide I should start to increase my quantity of sleep and start expanding my window? There's usually a few different signs. One is that you're starting to feel sleepy in the evening. Another is that your sleep efficiency is over 90%. So 90% or more of the time you're in bed, you're actually spending sleeping, or you're falling asleep like super quickly the moment your head hits the pillow, like, within 5 to 10 minutes. All of those are good signs that it's a nice try to go, by 15-minute increments to see if your body can capture the extra sleep. And if it doesn't, you can always just go back to the time that worked for you. All right, so that's sleep restriction therapy in a nutshell. If you're interested in learning more about the other CBT-I strategies, you can check out the other videos in the series. And if you're interested in learning about these strategies and how to apply it specifically to your life, you can also get my book. It's called The Insomnia Paradox. Otherwise, I'll see you in the next one. Bye-bye.